am a student at Williston State College, and today I'm going to show you how to get vitals. I'm outside the patient room, so I'm going to knock and then enter. As I enter the room, I'm going to wash my hands and provide privacy. And then I'm going to introduce myself. So hello, I'm Harmony. I'm a nursing student, and I'm going to be getting your vitals today. Can you verify your name and date of birth for me? And as she's verifying her name and date of birth, I'm going to make sure that it matches her wristband, which it does. Next, I'm going to check her chart, make sure that the chart shows the exact same name, check her chart for her previous vitals, which all look like they are within normal range, and I'm going to make sure there's no medications that are going to obscure her vitals. All right, we are going to get your temperature. This is an infrared temporal monitor, so it's just going to point at your forehead about 1 to 2 inches away. Perfect, we got 98.2. Now we are going to get your O2 saturations. So I'm going to feel your fingers, make sure they're warm and have good circulation, which they do. This little monitor does not hurt. It's just got a little light in there that's going to tell us your oxygen, okay? And while we're getting her O2 saturation, I'm going to non-obtrusively read her respirations. And I'm going to do so for 30 seconds, but if there was any irregular breathing patterns, I would do so for a full minute. Alright, so I got 7 breaths in that first 30 seconds, which would be 14 breaths in 1 minute. They were good depth, and they were a good rhythm. Her O2 saturation was 97% on room air, which is also good. Now we are going to get your radial and apical pulse. Do you mind if I palpate the inside of your wrist? So I'm going to get her radial pulse for a whole minute, but for this video I'm only going to do 30 seconds. Alright, I got 42 beats within that first 30 seconds, which would be 84 beats per minute. Now I'm going to listen to your apical pulse. Do you mind if I palpate your chest? Okay, so we're going to go down the midline of the sternum, move over to the midclavicular line, and then feel between the 4th and 5th intercostal. And on a normal patient, we would be going underneath this gown onto the skin. I'm going to listen to this for a full minute, but for this video, it will only be 30 seconds. Alright, I again got 42 beats per minute, which would be 84 beats, or 42 beats in the 30 seconds, which would be 84 beats per minute. Now I'm going to continue to listen to your apical pulse while palpating your radial pulse. Again, I'd be doing this for a full minute, but for this video, I'm only going to do 30 seconds. Alright, there is no pulse deficit. They are both 84 beats per minute. Your pulses are both strong and bounding, and the rhythm was good. There was no irregular patterns. Next, we are going to get your dorsalis pedis pulses. Can I have you remove your shoes and socks, please?
right.
And for this pulse, we are going to be palpating with the pads of our fingers. You're going to go between the crease of the big toe and the second toe and move up. Then you're going to do the same on the other side. And we're going to palpate this for a full minute. And in this video, it will only be 30 seconds. All right, we got 40 beats within 30 seconds, which is 80 beats per minute, and that is a regular pulse. They are equal and in strength and rhythm on both sides. Next, we are going to get her blood pressure. Do you have a preferred arm for that? Okay, so we're going to use a regular blood pressure cuff because it's going to cover 2/3 of her arm. And as I'm doing this, I noted in her chart that her blood pressure was her systolic blood pressure typically is between 110 and 120, so I'm going to be pumping the blood pressure cuff up to about 150 millimeters of mercury because that's 30 millimeters of mercury over her highest reading. First, I'm going to palpate the brachial pulse. Then I'm going to place the diaphragm of my stethoscope over the brachial pulse, making sure my tubing doesn't touch anything to give a sound obstruction. All right, your blood pressure is 118/84, which is within your normal range. I will document all of your vitals in your chart. I'm going to sterilize all the equipment before I use it on the next patient. I will make sure you are comfortable and the call light is within your reach. And I'm going to make sure that the privacy curtain is pulled or not pulled based on the patient's likings. And as I'm leaving the room, I'm going to wash my hands.